Agibeza uses, mechanism of action, and important information. Agibeza is a lipid-lowering medication used to treat dyslipidemia, high cholesterol and triglycerides in adults. It contains the active ingredient bezafibrate, a derivative of fibric acid. 1. Introduction. Agibeza is a lipid-lowering medication used to treat dyslipidemia, high cholesterol and triglycerides in adults. It contains the active ingredient bezafibrate, a derivative of fibric acid. 2.1 Mechanism of action. 2.1 Mechanism of action. Bezafibrate inhibits cholesterol biosynthesis in the liver, reducing the levels of very low density lipoprotein VLDL and low density lipoprotein LDL in the blood. Simultaneously, it increases the levels of high density lipoprotein HDL, contributing to the improvement of cholesterol distribution in plasma. 2.1 Mechanism of action specifically. Reducing VLDL and LDL levels. Bezafibrate inhibits the activity of HMCO reductase, the primary enzyme involved in cholesterol synthesis in the liver. This reduces the production of VLDL and LDL, two types of lipoproteins associated with cardiovascular disease. 2.1 Mechanism of action. Increasing HDL levels. Bezafibrate stimulates the liver to produce HDL, a lipoprotein that acts to collect excess cholesterol and transport it to the liver for processing. HDL is considered good cholesterol because it helps protect the body from cardiovascular disease. 2.2 Pharmacokinetics. Absorption. Bezafibrate is rapidly and almost completely absorbed when taken with food. However, absorption is reduced when taken on an empty stomach or after overnight fasting. Distribution. After absorption, bezafibrate is widely distributed throughout the body, primarily bound to plasma proteins. 2.2 Pharmacokinetics. Metabolism. Bezafibrate is metabolized in the liver, forming active metabolites. Elimination. Bezafibrate and its metabolites are excreted in urine and bile. 3. Dosage and administration. The dosage and administration of Agibeza will be determined by a doctor based on the individual patient's health condition. Generally, the recommended dosage is: starting dose 200 mg daily, taken once in the morning. Maintenance dose 200,400 mg daily, taken once in the morning. 4. Side effects. Agibeza can cause some side effects, including gastrointestinal nausea, vomiting, abdominal pain, diarrhea, liver increased liver enzymes, skin rash, itching, redness, blood decreased platelet count, other headache, dizziness, fatigue. 5. Precautions. Agibeza is not to be used in individuals with severe liver disease, severe kidney disease, pregnant women, and breastfeeding mothers. Patients should inform their doctor about any existing medical conditions and medications they are currently using before taking Agibeza. 5. Precautions. When using Agibeza, patients should strictly adhere to their doctor's instructions and not alter the dosage or discontinue the medication without consultation. It is advisable to take Agibeza with meals to enhance absorption. Always check the expiration date and store the medication properly. 6. Drug interactions. Agibeza may interact with other medications, including anticoagulants. Agibeza can enhance the effects of anticoagulants, increasing the risk of bleeding. Other lipid-lowering medications. Using Agibeza with other lipid-lowering medications can increase the risk of side effects. 6. Drug interactions. Antibiotics. Agibeza may reduce the effectiveness of certain types of antibiotics. 7. Conclusion. Agibeza is an effective medication for treating dyslipidemia. However, before using the medication, patients should consult with their doctor for appropriate advice and to ensure safety. 7. Conclusion. This information is for general knowledge only and does not constitute medical advice. It is essential to consult with a healthcare professional for any medical concerns or before making any decisions related to your health or treatment.